Hi, everybody, and welcome to another episode of Coffee Talks on Personalized Prevention from the Profit Project. My name is Borislava Nanieva. I'm the Capacity Building Officer at the European Patients Forum. I am also a patient myself. And throughout this series, we've been focusing on quite key and interesting topics on personalized prevention. And today we're continuing the talks with two very important ladies, which I'm very happy to welcome today to our interview. So Carla, Loes, if you can please present yourselves and what you do and why you're relevant to the Profit Project.
Okay, shall I start?
Yeah.
Yes, okay. My name is Carla van El, and I work in Amsterdam, in the Netherlands, at the Amsterdam University Medical Center as a sociologist in a genetics department. My research focuses on ethical and social issues of genetic testing and how they can be integrated into healthcare.
Thank you, Carla. Loes?
Yeah, hello, my name's Loes Lindy at Kreeftenberg. I'm also working together with Carla on this profit project, and my background is in health economics and public health. And together we work on the stakeholder engagement of personalized prevention and the role that engagement has, and also to be empowered with regards to, the personalized prevention of specifically chronic conditions. And I'm currently finishing off my PhD.
That's wonderful. Thank you, ladies. Moving on, we can start now with the actual, content of the conversation today. So if you can just walk me through a little bit, what is personalized prevention to begin with?
Yes, well, this recording is part of a series, and it might be good to just give a recap of what we think of when we talk about personalized prevention. It's part of a larger initiative on personalized medicine, which actually means to target the right intervention to the right person at the right time, because people differ. So also the interventions may differ. And in this project, the Profit Project, we focus more specifically on personalized prevention. So we hope to prevent health problems before they occur, or when they occur, we try to see how they might be lessened or how recurrence might be prevented. And in the Profit Project, we are part of a larger community on using genomics as a specific tool in a larger effort to stimulate prevention. So prevention is still important, for instance, in public health initiatives, but we try to add an extra layer, and this layer is genetics or genomics. So we try to think of how this particular individual has a certain biological makeup, what the genes involved could be, and how this individual could be supported in preventing diseases through also taking into account their environment, their lifestyle, and their behaviors. So that's in a nutshell what we mean by personalized prevention.
Thank you very much for the explanation. And as far as I understand, also from our previous interviews, it's very much connected to how the body of the person that we're testing is going to react to the different treatments that they're going to receive as well. And it's quite interesting to think in this case, but at the same time, I can't help but wonder, isn't timing very crucial in this moment? Because if you're going to be undergoing this massive treatment, let's say, I guess it's time is of the essence. You know what I mean? How much time does it usually take to perform a test like this and to get the results?
Well, in genetic testing, it differs a lot, and there's also a lot of development. Because if you would do a genetic test for pharmacogenetic variants that might influence your metabolism of a specific component, It might take little time. I must be a little bit careful here because I'm not in the lab myself. But if you would do a genetic test to actually try to find out a specific variant that is relevant for your family, because you have, for instance, have a genetic mutation, a hereditary disorder, that may take more time, into the weeks or months. But otherwise, it might go much quicker.
Understood. Thank you. Good to keep in mind as well. So here we have another question that is, what is the role of patient engagement in personalized prevention? I think, Loes, you would like to take that one?
Yeah, sure. So yeah, patient engagement can mean so many different aspects. It means involving patients and citizens in different ways, whether it's, locally, nationally, regionally, but also for different disease groups, for different people. So there are very different, ways of involving patients, and that can be by informing them, listening to their views, including them in decisions about how care and prevention can better meet their needs and their preferences. So it really is about reflecting their real lives and their preferences. And like Carla mentioned, prevention becomes more tailored to the individual and to their, personal circumstances, whether it's family history, lifestyle, and genetic information. So some people need, clear information and the right support to understand their options, to ask questions, to share their concerns, and to take an active role in their own health and well-being and their decisions. So it's also about being empowered with that information instead of just being passive receivers of care, if I can say that in a nutshell. So yeah, Prophet really looked much at the role of engagement in three domains: research, care, and governance. And each engagement looks differently depending on those three domains. Yeah. So maybe I'll mention an example if we, yeah, is in the research, for example, you can involve patients in shaping what is studied and what it matters most by, for example, being together collectively, identifying relevant research questions or priorities, or going through informed consent papers, which might be very confusing, and making sure it's very understandable in, simple communication. In the care domain, the second domain, it's really about helping patients understanding their options, for example, their risk prevention options, genetic information to make the informed choices. And last but not least, the governance domain is giving patients and citizens a voice about their risk, but also to be prioritized, organized, and be part of the decision making on a higher level. Yeah.
Indeed, I think that patients really have a crucial role to play in all of what you mentioned so far. I think it's even stronger when it's coming from already a patient organization representing a whole community or a whole disease area, or as you said, it doesn't matter if it's going to be locally or if it's going to be per disease area. And I think that the feedback that patients can give when information like this is being developed is really invaluable, because at the end of the day, they are the target group, right? Like they are the ones who are going to have to fully understand, comprehend, the process, and act accordingly on this information. And I really think one of the main areas of work of EPF is really to have more empowered patients. And then that's also another side of it, to have patients who are really a part of their own treatment, a part of their own future planning, and so on. And I think this is really very important. And as you very rightfully mentioned, in order for this to happen, the information has to be in as lay language as possible to reach as many people as possible, and in order for people to really fully understand what it means. Because otherwise, if we're going to talk on like academic level and so on, we're not really going to get very far in reaching with that information.
Yeah, exactly. And that also means, targeting for different audiences. different languages, language barriers, but also health literacy barriers and so forth. Yeah, exactly.
Yeah. I really hope that also with these interviews, we manage to reach out to a wider audience and for people to really understand what is meant by all of this, because you've done really a lot of great work in the Perfect Project. But, you know, I think at the end of the day, what matters is really how it's well distributed to the general public, to the patient communities, because you can do so much amazing work, but then if it stays in this, in this little box, then is it really,
Exactly.
is it
There's
really
something
useful?
about doing evidence, but there's a second point of actually translating it into, the execution part. And luckily, Carla will talk about that, the capacity building and the toolbox that we're working together with EPF and ACN, but that'll come at a later stage.
Yeah,
Yeah.
indeed. And then to build up on the previous question, what tools and materials are available to support the patient engagement?
Yeah, you're already laughing because it's such a, there's so many tools and materials that can be used. You've probably also seen in your work with EPF, but it really depends on what goal you're going for. And is it just about information provision or providing that information? Or is it also about, actively taking decisions or policies or etc.? So different materials and tools don't involve patients in the same way. It's mainly used to understand people's views. So the inputs, the one-way type of engagement. Yeah, we can go to the
Yeah.
next slide. So that's, the one-way type of communication. As you can see at the bottom of this table, it's really the surveys, the questionnaires, the interviews, the focus groups. It's all about understanding people's views and getting their input. But you also have more active approaches to involve patients and, to partner with them. For example, at the top side, you can see the more higher end of the engagement spectrum is, for example, through patient representativeness in working groups or patient organizations, patient committees that are being established. So this is more of a different kind of role, more partnering, more collaborative, more of a two-way street type of thing. So in this table, you can see the different inputs, from the bottom to the top. And, a good example of, more of the lower level of engagement that we can see here in the red circle is a focus group study in Sweden, where they looked at how people felt about sharing their hereditary cancer risk information with family members. And this was valuable because it, helped researchers understand people's experiences and concerns, including, that sharing this kind of information can help, understand what they're feeling, and that it was very difficult and emotionally heavy and, quite a psychological burden. But it was also mainly a way of just gathering views, a one-way type of thing instead of the shared decision making. So that's why the second option is a higher kind of engagement, where this includes an example of France with regards to the establishing patient committees in oncology research, which really went further. Instead of just getting the patient's or citizens' perspective, they really, were not only asked their opinions, but they also became partners over time and helped shape the work. So this is, a nice example of a stronger, meaningful engagement that, we found, and that, this doesn't mean good or bad. Different engagements are for different reasons and different goals, but here are some examples. So different tools, a lot out there. Yeah.
Of course, of course. And I think we keep coming back to the same question, engagement versus involvement, because then involvement is really kind of the basic, we invited them and they listened and, and did they participate meaningfully in the conversation? Was there something taken from the fact that they participated in this conversation? So I think it's really interesting to see how many different tools there are. And then at the same time, I think it's very important how they're being used as well. And I really hope that we manage to get much more engagement rather than involvement, and this kind of tokenism that sometimes happens when it comes to health-related projects, where it's like, we involve the patient. and then it means that that he was present at the table, which
Yeah. And that's an important topic that you're bringing to the table, because we saw in a lot of those engagement practices that it was kind of like a checkbox sometimes, is oh, they were engaged, but nothing about how or when or what process or which methods and tools. So that, evaluation or feedback of the engagement practice is also important to understand what works and what doesn't for who and why and which disease group. So
indeed.
yeah.
Indeed, the continuous engagement, I think, is something that is the most important. But yeah, I'm sure that we'll get around to that as well. So how can engagement be improved then?
Yeah, it's also a question for you actually, Roslava, with your EPF work. But what we see is that in Profit we conducted the interviews and focus groups with help of the European Patients Forum, and also the Active Citizens Network, which is also a European organization focused more on citizens. And we collected input for several recommendations across the previously mentioned research, care, and governance. Uh, recommendations for better engagement. So for example, yeah, we can see here on the right-hand side all the different recommendations. And here circled in red under the research domain, one key recommendation is bullet 5, encourage participation in research, also for individuals and communities that may be difficult to reach or not included in research. And this really raises a point of raising awareness that public engagement matters, improves quality of research, and also making stronger effort to include people and communities that have been overlooked. And this can be, for example, working with patient organizations like with you, community groups, trusted local networks to involve, engage people who face language barriers, lower health literacy, or less trust in the system, especially with the whole geopolitical situation. So this helps make research more relevant and more connected to real life needs if we include all voices. Yeah. And then the care domain is bullet 2, collaborate with community intermediaries to effectively reach and support underserved or hard to reach populations. Yeah, this was also one of our findings in the care domain, where it's important to value those community intermediaries, and these can be patient organizations or trusted local organizations which help explain information and be that intermediary, that person. They can say it in lay language or in simple, no complex terms, and make it more accessible to the public. And then, the third point of care domain is build trust through open, honest dialogue about treatment options, risks, and personalized prevention strategies, and also through informed consent. So, thinking about how personal and health data are used and protected, and ensuring that the need of accessible information, transparent communication, the inclusivity, and attention to the the ethical, legal, and social issues that can arise with regards to your own data. So it's really about open and honest dialogue of what do they want, is it understandable, the informed consent. And last but not least is the governance domain. And here, we look at the integrating health prevention education into school curricula and provide ongoing community outreach activities such as health workshops. So, the importance of school education and effective communication is so important to understand personalized prevention and why it matters and how decisions are made. So by introducing this earlier on in schools, for example, you can become more confident in discussing prevention and health information later in life, whether it's lifestyle, diets, genetic information, which can play such an important part of how your health and well-being is put together. So yeah, and then on the left-hand side here, you see the different QR codes to the research that Carla and I and the team at Amsterdam with the Profit and EPF and ACN have conducted. So feel free for detailed information there.
Yes, of course. If you want to learn more, please feel free to scan the QR codes and read more in detail about everything that we're discussing now. I think these are actually spot on findings. To be honest, something that keeps coming up again and again is really the worry of the patient community when it comes to how their data is going to be used. Because especially this type of data where it's really like, the prognosis and the potential of, developing chronic conditions and so on. And then if this gets in the wrong hands, or, because a lot of the patients are discussing how a lot of the information that they have collected, it goes to, hospitals and so on, but then insurances also have access to some of the files that they have, and then there it can get very tricky. So it's really crucial what you found here, and I'm very happy that it's being really well documented and examined in this way. So now I think we can move on to Carla's side again. Just a second. Yes, there we go. So how can we bring the patient engagement into practice in that case?
Yes, so in the Profit project, we try to think through how to better implement personalized prevention in the end. And what we did together with stakeholders and after going through the literature, we developed a so-called strategic research and innovation agenda. And this sets out 10 challenges that we came across. So these challenges, for instance, they address the data sharing you just mentioned, but also ethical issues and regulatory issues, but also the topic we're discussing today, so community engagement, building trust, and behavior change. And this agenda explored, so what's the state of the art, what are the gaps, and what should be our priorities to address when we want to stimulate personalized prevention further. So what we did is we summarized these challenges into a specific roadmap. So again, on the Profit website, you can find more information, but we published this document. It's a very lengthy document. Also, you will find the location here. And we try to think through for every priority that we identified, who should take action for what. So what priority, what do we try to aim for, and what should be the time frame, say within the next 2, 5, or 10 years. And in that way, we try to really sort of develop a strategy towards addressing and identifying the priorities, but also how to tackle them and who should tackle them. Well, for instance, if we think about community engagement and patient and citizen involvement, a recurrent item is a lack of health literacy and genetic literacy. So what Loes addressed before was, for instance, that we should start in school. It's not a one-off. You should really try to stimulate raising awareness on possibilities to actually improve health, and also new tools that we have developed in genetics, but also in digital tools, and make people aware that they exist. But to do so, you would need, for instance, more structural funding for such engagement activities. So, for instance, you could set out a policy that whenever a funding agency, be it national or at the EU level, is having a call for research proposals, that a specific work package or a specific percentage of the budget should be focused on citizen engagement. So in that way, you could actually make sure that that you can have structural attention to health literacy issues. Another thing is that you may try to, so in this case, we're looking at funding agencies, but you could also address via this agenda professional organizations, from healthcare professionals, policymakers in the EU when they try to make new strategies for personalized prevention, and sort of address them directly and see if they can be interested in taking up our recommendations.
That's really great, and something that I really kind of impresses me from what you're saying so far is that I've seen so many projects where there's like, we have this recommendation, that's it. But then here you're actually saying we have this recommendation for this person to do in this time because it's necessary to support this and this. So it's very, you can't pass on this, you know what I mean? So I'm very impressed by your work.
Yeah, so we really hope so setting up the strategic research and innovation agenda is one thing, but now we need to disseminate, and that's part of what we're doing today. And we're also trying to engage with other projects, other European projects, and European policymakers and national policymakers. For instance, in March, we had a meeting in Rome with almost 10 European projects that were also working, for instance, on cancer. And they had also lessons they could share with us, and we could ask them, okay, you're still starting up, or you're still developing your research. This is what we have, and can you take our results with you in the coming year? So that was very productive. And well, Profit is almost finalizing. So in Brussels, we will be sharing our results with policymakers in Brussels. That's close to the European bureaucracy. So we hope also to be able to give our message and send them the information firsthand, so to say.
As you should, as you should. I'm rooting for you, fingers crossed, really, that it gets through to the right people in the right time. I really think that this is something that is much more necessary on a much wider scale, to be honest. And what you and Loes have mentioned so far, Carla, I couldn't agree more with, because I'm originally from Bulgaria. Currently, I live in Belgium. And I can tell you very confidently that in Bulgaria, while I was growing up, there was zero mention, zero like education in like just a regular normal school, about health management, about hey, you should be careful about this and this. And we just had the very how can I say, conservative sexual education, and it was really half an hour, don't do this, bye, you know what I mean? So I really think that at the end of the day, we should open up a lot more about our bodies and about what is happening with our bodies, because at the end of the day, this is something crucial for our life quality, for the future of us, for the future of our children. And it's really something that we need to focus on much more. And especially when it comes to prevention, obviously, I think that some EU member states are quite advanced rather than others. For example, I have a friend that is living in the Netherlands, and she told me that you get sent in the mail, like the pap smear and stuff like this, that is like quite important prevention protocol. So I'm very impressed with some of the prevention protocols in some of the European member states, and I really hope that this is something that the Profit Project can boost as much as possible, because we really need it. I mean, just looking at data in previous times, we really need some proper prevention protocol, all of us.
Yes, and that's also why international collaboration is so important, because you can learn from each other and each other's examples.
Indeed.
And I think, especially with genomics, it's also important to sort of manage expectations, what can and cannot be done. For instance, some people might think, oh, I have this genetic susceptibility, so why bother? I will be sick anyway. But this is not the case. If you are well informed, you might also know that, okay, I might have a higher susceptibility, but still there's something I can do. I can still be as healthy as possible and diminish the risk of becoming ill in certain situations. So that would be very good to know and to have realistic expectations.
That is very true. And something else that really, while you were saying this, kind of sparks in my mind is that within the patient community, so already people with chronic conditions, already existing chronic conditions, when you mention the word prevention, it's taken a bit strangely, because a lot of people also say, I'm already, I already have this chronic condition. I'm already a patient. What do you mean prevention? But if we take even my case, for example, I have kidney transplantation. So I'm taking immunosuppressive therapy for many years now. But that doesn't mean it's done. That's it. At the end of the day, because of the medication that I'm taking, I'm susceptible to unlocking diabetes, having, like a skin cancer or something like this. So the need for prevention is even greater, I feel like, than in a healthy person. You see what I mean? So I think that we should also work a little bit on how it's perceived, the word prevention, you see.
Yes, indeed.
So moving on to the next question, how can patients and citizens learn more about the Prophet Project?
Yes, well, I hope everyone will be inspired to have a look at our website. And on the website, you will see we developed a so-called toolbox, which is meant to be used for capacity building. And we tried to summarize all the information we gained from the literature and from our researches for 3 categories. So for healthcare professionals, for policymakers, and for citizens and patients, to have sort of 3 portals that you can go to, and you can open them and see so what we did. And we are currently still developing the materials. So we try to summarize our findings, for instance, into fact sheets that are, well, relatively good, well accessible. And some are further translated into more lay languages and some more national languages, because yes, unfortunately, some people have more difficulty with English, and it's wonderful that we can communicate in English, but it might be also good to have more information relevant for you in your own language. So we are able to do so. So maybe we can go to the next slide.
Yeah, just a second, sorry.
Yes.
Very good.
Yes. So for instance, if you click on the citizens and patient toolbox, we have more information on what is personalized prevention, what is meant, and what can you do, what is this concept, and some examples. For instance, when we think of genetics as a way to help us further stimulate prevention, in some families, you can do family screening or so-called cascade screening. If you have one index patient, you can go and look if there's a familial risk that might be, for instance, 50% in other first-degree family members. You can go into the family and develop information materials and try to inform people if they can also have preventive measures. Same goes for pharmacogenomics. Some variants can be identified that can help you stratify the amount of a certain medication that would be helpful for you if you would not overdose or underdose the medication itself. In the last, you see the communication and educational materials.
Yep.
Here we have all the information on websites, and I think our conversation today also will end up here. And external links. And external links, we are still working on those because there's so much material available also from EPF, but also other citizens and patient organizations, professional organizations that have readily accessible materials. So please have a look. We're still under development, but we try to make it a toolbox that will be available also in the coming years after the project ends. and we hope everyone can find more information there.
That's great and very much necessary in today's day and age. I think it's very good to have this kind of resource point with so many other resources included inside. So indeed, for anybody that is looking to learn more about this, you could scan the QR codes. We're going to post also the hyperlinks. So many different ways to get introduced and learn more about the Profit Project. And here I see we have some information about the European Patients' Rights Day.
Yes, that is also initiative from another partner in Profit. So we were very fortunate to be able to collaborate as an academic institution ourselves with two organizations, the European Patient Forum and Active Citizenship, that try to to bring and communicate with both citizens and with patients, because these are two groups, and patients are sometimes more organized already because of not being interested in a specific disease, and citizens are sometimes more difficult to reach. So it was really, we were very fortunate to have into the Profit Consortium these groups that collaborate with us and bring their communities to our research. And so the European Patients' Rights Day is organized by this partner, Active Citizenship. And I think also EPF will be involved and will be speaking there. So we're very, very happy to advertise for this event today. So please join us also on this round table and to discuss further what European patients' rights might mean in this day and age of genomics developments.
That's great. Thank you very much. And maybe as a closing remark, if both of you want to say something for our audience to kind of take away from this whole conversation, what would it be? From my side, and this is something that I mentioned also before, is don't be afraid to discuss with your family about the family issues and family conditions and what grandma had and so on, because at the end of the day, it can also help save yourself, and it can also help save your future children. So quite important to have a little conversation, let's say, with our families on these topics, even though they're difficult. Carla, if you want to say a takeaway message from today.
Yes, I fully agree. And some people, including myself, might be somewhat taken aback by all the new developments that are happening, genomics developments that are happening. But the message should be that citizens and patients and healthcare professionals and researchers together, they need each other to make sure that we improve our healthcare. So please don't hesitate to ask questions, because the other groups are there for you, and together we can make the next step.
Fully agreed. Thank you. And Loes, what about you?
Yeah, I'm echoing what both of you have said. And also, Borislav, what you mentioned before about prevention, there are different types of prevention. You have the primary prevention is before you have the disease, but you also have the secondary, tertiary prevention. So don't think that prevention is exclusive to you, when you have the disease. And it's all about, actively being part of that discussion and being empowered as an individual to take that active role in your own health and well-being, whether it's screening, lifestyle change, follow-up care with your healthcare professional. It's all about, engaging in that conversation.
That's perfect. Thank you very much, ladies. It was very pleasant to talk to you today. And join us on social media. Let us know what your thoughts are, and like and share. And of course, we'll see you around for more of this. Thank you.